Super Leader from Portsmouth. I want to thank you for coming, and I want to thank you for not having metal detectors. I want to thank you for not giving us a little ticket to go into the raffle for questions. I also want to thank you for not having the special guards all around to guard us like we're little kids and need to be minded. And I want to thank the guards on Saturday for allowing me to keep my umbrella, so I wouldn't have to use it as a lethal weapon for anybody on a rainy day. But I also asked Congresswoman Shea-Porter back in March when she had one of her rare town meetings about, in that occasion was the stimulus package, because I knew she hadn't read it. And I openly asked her, I said, have you read the bill? Did you read it? Because I did. I tried to pull it up in the system and read some of it. And she said, well, you know, the language is such and what have you. Do I read the bills? No, I don't. Okay. So on Saturday, somebody asked her something about the bill, and she said, I read the bills. Now, the stimulus was a lot less complex than that bill. Do I believe that statement? I don't think so. I think congruent with her previous statement. Now, my question to you, she said something about that you get, this is a major argument, you get to keep the health insurance you have. My question to you, have you read page 16 of that bill, and can you tell us exactly what it says?
I've got page 16 home. Page 16 is a very, there's a paragraph in page 16 that is very concerning. And Sue, you name it Sue? Yes. The question that she's referring to is the limitation on new enrollment. And I'll read it to you. It says, except as provided in this paragraph, the individual health insurance issuer offering such coverage does not enroll any individual in such coverage if the first effective date of coverage is on or after the first day of year one. And let me try to explain that because it probably doesn't make much sense. What that says, essentially, is this. The issuer is the insurance carrier. First of all, they change, after this bill becomes law, if they change their policy in any way,
You're dead.
you lose your insurance.
Yeah.
That's number one. Number two, this bill incents employers to make a decision to drop you as an employee on their plan, because it's cheaper for them to pay the bill, the fine, than to pay for your health insurance. What happens in that situation? You go on the public option.
Which is no option.
That's the concern. So when you hear people say this is national health care or it's government-run health care, that's what people are referring to. Now, there are people who disagree with that assessment, but it says it right here on page 16.
My name is Joan Jacobs, and I'm from Portsmouth, New Hampshire. And I do agree with you on one point that you're saying that we really need to put priority on building our economy back up. And my understanding is that small business is a big engine for creating new jobs, especially here in New Hampshire. What do you say to the small business owner who cannot afford to purchase health insurance for himself or for his employees? What do you say about the fact that health insurance premiums now cost the average worker more than housing? What do you say to the fact that health insurance premiums are rising 5 times faster than wages in this state? And can you please tell me how many people in this state do not have health insurance, and what you would do about it, especially for small business owners?
Well, thank you very much for the question. I grew up in a family where my parents ran a small business, and my mother was actually in the audience today, Ginny Guinta, if you want to stand up and say hello. I watched my parents work for 40 years in building up a business so they could provide for me and my brother and my sister. And I'm very proud of that. It's where I learned about work ethic. It's where I learned how to serve and try to serve for others. I also watched them struggle. And you're right. Small business in this state is the driver of our economy. It's about 95% of our economy is driven by small business. Many small businesses cannot afford the cost of doing business. And I wouldn't just extrapolate out healthcare. I would look at the payroll taxes, I would look at the corporate taxes, the personal taxes, the healthcare responsibility they have. You add those up, and it is very difficult to be a productive business, creating jobs and providing for those employees and their families.
Would you agree, Mayor, that small businesses, when surveyed here in the state, said that the cost of health insurance is the biggest burden on them?
Yes, I do.
Thank you.
Yes, I do. But I don't think the answer to solving that problem is allowing the government to take over and run health insurance. And I respect your position and I respect the question.
I'm wondering what solutions that you would have.
Well, talk about a state level or a federal level. I mean, on the federal level, there's a few things that we can do to help a small business owner. First and foremost, you should be able to pool with another like business or something. It's been talked about for years. We ought to try it. That alone gives a small business the buying power of a large entity. Secondly, let's not solely focus on the employer. Let's give each individual, let's empower each of us to control our own health insurance and our own give each individual the same tax credit that a large employer gets for providing health insurance. That would alleviate some of the challenges that a business has, and it gives us direct responsibility over our care. I think those two changes would be significant for small business, not just in this state, but any small business owner across the country.
One of the things that chills me and frightens me is there are excerpts in the bill, for example, on page 58 and 59, that have to do with the ability of the government to have access to our real-time transactions, our bank transactions, and for the IRS to have access to tax us if we don't comply with the requirements of this particular bill. I believe in my civics class 100 years ago that the Constitution protected the right to privacy. Is this bill unconstitutional? Is my question.
Well, first and foremost, let me say this. The government should not have access to your bank account.
Amen.
That in and of itself is a problem. That is a huge problem. It's a problem that I don't think is Republican or Democrat. I don't think anybody in this country wants the government to have direct access to their bank account. So to answer your question, again, I think there are a lot of unconstitutional ideas and pages of this document. And just on that alone, we should be looking at, again, those direct reforms that go to the direct cost issue or the direct access issue for people who can't access health.